Well, pancreatic cancer is the fourth leading cause of cancer death in the United States. This devastating disease rarely causes early symptoms, so it's often diagnosed after the cancer has already spread. The Lustgarten Foundation was established to transform pancreatic cancer into a curable disease and improve patient outcomes. For the second year, CBS New York is a community partner of the Lustgarten Foundation to help raise awareness and support their medical research. This Sunday, Natalie Duddridge will emcee their New York City Walk for Research. Joining us now to discuss advances in pancreatic cancer treatment is Dr. Selvin Vickers. He is president and CEO of Memorial Sloan Kettering Cancer Center. Doctor, thank you for being with us. We greatly appreciate it.
Thank you for having me.
So let's talk about pancreatic cancer first and foremost. Why is this cancer so difficult to beat?
You know, it begins in a subtle way. The pancreas sits in the center of your abdomen, and it's not easily detectable by anything that we could do on exam. And often when it presents, it's already far advanced. So in practice, it begins subtly. When we detect it, it's already grown to significant size and often spread.
Now, can you tell us a little bit? There's a promising mRNA pancreatic cancer vaccine trial that's being supported by Lustgarten. Can you just give us a little information about that? And I guess just how much of is there a pot of gold at the end of this rainbow?
It's the beginning of finding gold. There's a lot more digging to be done. Dr. Vinod Balachandran, who's one of our surgical scientists, really during the pandemic conducted the first early trial, which took patients who had pancreas cancer, who were able to have their tumor removed, and then asked the question, were there markers on the cells that could help the immune system identify these cells if they were to recur? So they took these tumors, looked for what was called neoantigens with a technique in a field called computational oncology. They were sent to Germany to the same company that made the COVID vaccine. And in doing so, they developed a person-specific, if you would, a personalized vaccine for each of those patients. Those vaccines were given in a credible time, that is within 7 to 9 weeks after their surgery. And in doing so, those patients got regular therapy, but the vaccine in addition to that therapy. And at this point, almost 50% of those patients who got the vaccine have not had a recurrence of their tumor, where those who normally would have not gotten the vaccine have already had their tumors come back.
So it sounds like
the goal is to do it in a larger study, but it really is promising.
It sounds like a great breakthrough, though.
It is. It's building on the work of this mRNA material to actually be effectively used to prime the immune system to ward off any recurrence of tumor.
So the vaccine news, obviously that is good news. There's also some bad news, as there are with the number of the cancers we talk about. There's a rise in pancreatic cancer rates, especially among young Black women. Can you explain why this might be happening right now?
You know, it's not clear. The modifiable factors that really affect pancreas cancer are smoking, some level of alcohol intake, diabetes, our weight can affect it as well. It's not clear that any of these played a role in this study, as it was a study looking at records, but not in detail that you might have with other studies. It does indicate that for younger women, that this increase is occurring, and specifically, this appears to be more common in African-American women. That's concerning and disturbing. It's also makes us aware. It's a bit frustrating. Like any of these studies, it doesn't give us the answer why. And unfortunately, it wasn't designed to do that. And that's the norm for these studies, not that there was any failure in it.
Can we talk about ways of preventing pancreatic cancer? Are there ways to prevent it? I mean, aside from what you just mentioned, smoking, alcohol, things like that, are there other ways we can reduce risks?
Unfortunately not. We would like to think that there are ways, obviously activity, physical activity, maintaining a good weight, and avoiding smoking, as you mentioned, or secondhand or primary are the best, but there aren't any other major modifiable things that we would recommend people do that would have a significant impact on preventing pancreas cancer.
Before we let you go, the Lustgarten Foundation has made funding new research their mission. How important is that work and the progress that's being made? I know just some of the things that we've talked about here in the last couple of minutes show that there are some promising breakthroughs out there, but just how important is it to keep up the funding?
It's extremely important. Obviously, no one wants the diagnosis of cancer. And we've made great progress, largely in those common cancers like breast, prostate, for example, and we're making progress in lung. And there's significant funding in those areas. Pancreas cancer often is sort of the stepchild of funding. And so groups like the Lustgarten Foundation providing that extra funding that the federal government often doesn't provide is essential for this work to go forward and make a difference in which is a devastating disease.
Is there a reason that it is treated kind of like as this stepchild, since it is such a popular cancer? Does that kind of surprise you a little bit?
Yeah, not so much. I would think over the last several years, the incidence has grown significantly, where it probably, when I first started, there were about 35 to 40,000 cancers a year. Now there's 64,000 cancers a year with 50,000 deaths. So if you look at breast and prostate, they're approaching 200,000 or 150,000. So their incidence is higher. So you can understand why there might be more funding. But clearly we've made good progress in curing those tumors. This one has this unique scenario being only 9th in incidence, but 4th in mortality, which means it's not that common, but it is very lethal. And yet it is growing to be more common.
That is the dangerous part about it. You hate to hear about higher numbers in order to get more funding. You want to keep those numbers down, but you hate how one correlates to the other. Dr. Selvin Vickers, thank you so much for taking a few moments for us. We greatly appreciate it.
Thank you for having me.
The president and CEO of Memorial Sloan Kettering Cancer Center. We again thank you for your time. Now, the Lustgarten Foundation's New York City Walk for Research is this Sunday, April 16th. You can join CBS New York's Natalie Duddridge and Ali Bauman at Pier 84 Hudson River Park to help support the cause. Events get started at 8:30 a.m. The walk steps off at 9:30 a.m. And for more information, go to our website, cbsnewyork.com.